Welcome to season 2, episode 10 of Dr. G at the Heart of Healthcare. We have Nurse Sharon in the house. Hey,
Hey,
Sharon.
hello.
Hey. Sharon Harris is a nurse and an end of life doula, and she is co author of The Real Deal About Hospice. Where's your book?
Right here.
She
Yes.
she designed this cover too. So anyway, we want to come to you today to because it's ALS Awareness Month in May, and so we have chapter 1 in our book that's about ALS, and so we're going to talk about that after we chit chat a little bit. How you been doing,
Okay.
co-author?
I've been doing good, hanging in there. Just keeping busy. Keeping
Good,
busy.
good. I hope you had a good nurse this week. I haven't seen you since then.
Yes, yes. Nurses Week was great. Awesome.
Awesome, awesome, awesome. All right. Well, today you get a treat for Heart Month. Earlier this year, we did the read along for Heart Month, and we had that cardiologist with us. Today you have us, and we're going to do a read along for chapter 1 in The Real Deal About Hospice. And I want to remind everyone the way that the book is laid out. First, we have a preface and an intro that's very informative. And each chapter has a challenge that we commonly see in hospice care. And these are the things that we overcome. And I don't want to minimize that these challenges are things that are very devastating to families and patients. But for us, uh, we use our professionalism and our skills to help families and patients. And so for this particular for each chapter, you'll see that the first part of the chapter is a story, and the second part is discussing the advantages of hospice care. Anything you want to say about that, Nurse Sharon, before we jump in?
Uh, yes, probably what I always say, but it's just a blessing that I've been able to experience this journey with a lot of the families that I've been with. Um, and again, this book is the real deal. It's going to give those regular, lay folks just a general understanding what hospice is. It's
Yeah.
not a scary word. Don't be afraid of it. For those who are lacking access or information to hospice care, palliative care, this book will help shed some light on that and give you all a better understanding of what it is.
Absolutely. And, people have complimented it. Remember we had that letter from end of life doula from South Africa who was starting her
Yes.
private practice and it helped her. Um,
Mm-hmm.
it, in my opinion, if I had to summarize the book, it is giving hospice eligibility in the form of stories. And
Yes.
so it doesn't have an exhaustive list of the conditions that are eligible for hospice care, but it does have those things that are common. So we have 9 chapters here. Chapter 1 is ALS. We're going to jump in a sec. Chapter 2 is Alzheimer's disease. 3 is cancer. 4 is heart disease. 5 is HIV. 6 is liver cancer, 7 is pulmonary disease, 8 is renal disease, 9 is stroke and coma. Then we have a conclusion, frequently asked questions, invaluable resources, and finally, hospice myths. So today, let's do this read along of chapter 1. I'll say the challenge, and then Nurse Sharon, you can go ahead with the story. So the
Okay.
challenge for chapter 1 is misunderstanding the unique, helpful roles of the hospice interdisciplinary team members. And let me remind you, the hospice interdisciplinary team members include doctor, nurse Sharon, chaplain, social worker, hospice
Mhm.
aide, and some bigger hospices have other things like music therapy, dietitian, all that other stuff. But those are the core members there outside of the hospice aide. So let's jump in.
Okay. Okay. Chapter 1, ALS. Okay. Sal was a 58-year-old husband and father of two teenage boys who was diagnosed with ALS at the age of 55. He had siblings who were very supportive and were with him until his last breath. Melinda, his wife and primary caregiver, was having a difficult time with his illness as he lost the ability to move and communicate with her. He was now bedbound with his hospital bed in the middle of the living room, where he was easily surrounded by his family. Melinda remained tearful most days as she watched her husband's rapid decline and would often retreat to her room. One day I had a conversation with Melinda, reminding her of the different roles of the IDT members and how they could be of assistance to her. Sal lived an adventurous life prior to ALS and adored spending time with his family. His request was to have his family surround him in his final days. I witnessed an ongoing celebration of life where they played music, sang and danced, and happily obliged when they included me. Whenever Sal had symptoms that needed managing, I stepped in to provide nursing care and would fade into the background, allowing his family the time with him they requested. I also answered the many questions of his children and siblings regarding his end of life symptoms and care. They expressed their gratitude for my presence. When Sal's death was immediately imminent, I called for Melinda and the children. They arrived bedside and were able to say their final goodbyes. About a week after Sal passed, I ran into his family at a local grocery store. I noticed that Melinda was still having a difficult time dealing with Sal's passing, and I explained to her the different roles of the IDT members, and with her permission, suggested that I would have them give her a call to be of further assistance. We exchanged hugs, and they expressed gratitude once again for my being there. This kind gesture warmed my heart. And then just before you get into to your part, Dr. G, I just like to say that this family is just also just so near and dear to my heart. I say that about everyone, but because I'm just so passionate about what I do. But yeah, this was another one of my experiences with the family that I was grateful to be able to be a part of, and we'll cherish it always. Yeah.
All right. So the advantages. Here we see anticipatory grief in Melinda. This emotional distress and all psychosocial symptoms are assessed by the RN case manager, or LVN/LPN in this case, who then reports to the interdisciplinary team. This becomes a part of the plan of care. The hospice aide helps with activities of daily living and personal care. The hospice physician can treat the patient's anxiety, pain, and infections that may arise. The social worker and chaplain provide emotional support. A nurse practitioner is also a part of the team. As a patient with ALS, muscles weaken, it not only affects the ability to move arms and legs, it affects the muscles of respiration. The patient may require the use of something called the Trilogy machine, non invasive positive pressure ventilation. Some hospices have a respiratory therapist on staff, others outsource. Some hospice agencies do not accept patients with a ventilator due to cost. Do your research. And then see valuable resource number 6. This family benefited from the IDT of hospice care so that the patient could have the quality of life he wanted with his family surrounding him at home. He was not on care for long, but he was able to make the most of the time he had to live. The chaplain provides emotional, spiritual support and was there for Melinda. The social worker provided resources to support Sal's children. Young kids who are experiencing the grief of a dying parent may be connected to child life organizations so they can navigate the process. The whole interdisciplinary team can host a care conference with the family to discuss goals of care. A family meeting such as this can help everyone accept the imminence of Sal so that their road of bereavement is not complicated. And there you have it. Care conferences are like my favorite thing to do. Yeah, so again, the point of that chapter was to help you see the physical decline of an ALS patient. You know, sometimes they have breathing issues. They're basically quadriplegic. It's difficult on the spouse watching that. There's family dynamics involved. And also you have to pick a good hospice agency that is going to take someone that may have, the breathing machine or things of that nature. So that was a point of that chapter. Have you seen a lot of ALS patients in your career, Nurse Sharon?
I have. I've seen a good number of them. Always touching. And again, with this member, I'm sorry, this patient, being that he was on the younger side with the teenage kids in the home. So it was good that the IDT team could be of good support for them as well.
Mhm.
And then also, being that some of the patients are younger with that ALS diagnosis. It's life changing. Of course, it's altering. Not only for the spouse, but again for the children. And in this case, Sal, he was very adventurous, very outgoing. Um, family, they just gathered all the time. And did things. So it was difficult, for them to watch it, but with me being bedside there was very helpful, in that I was able to immediately answer any questions, explain, what was going on in regards to any symptoms that were kind of getting out of control. Um, so it was good. It was good. So it did display or did show, how hospice did benefit that particular patient and the family. And I keep
Yeah.
saying and the family because it's not always, the patient. It's a unit
Hmm.
that we're
Hmm.
supporting there. So,
Yeah, yeah. The unit of care is a patient and family.
hmm,
And two family stories stand out to me in my real life. Everyone, obviously we have to protect patient privacy. So the
right.
stories in our book is a composite of different experiences we've had. And so, one that I often bring up where I have these Camus bottles here, this was a patient, actually a veteran. It's interesting
Mm,
because we're recording this on Memorial Day. So I
yeah.
dedicate this to this person who had a really, really good death, surrounded by his family, snuggling with his wife at the
Good stuff.
community living center at, is it called the
Hmm.
community living center at the VA? I think it is called that. And so he had a really rapid decline. Once he was hospitalized, things started going downhill. And, I was able to help facilitate them with advanced care planning and getting things on that road to where what his wishes were and what his eyes
Hmm.
eventually spoke when he wasn't able to speak anymore.
Yeah.
And it was great. And his family came around after he passed away, and they were really pleased with the way that they were able to put him to rest. And the daughter always said nothing was left unsaid. That's the thing we want to
That's good.
hear
Hmm.
from our families. Another
Yes.
one, yeah, this is a hot topic in a lot of arenas right now. In a few states, medical aid in dying is legal, and we're in California here, and so there are people who are exercising the End of Life Option Act here. And I can recall a patient who had ALS very young, actually
Hmm.
maybe 20 years younger than our patient Sal from the book.
Hmm.
And
Hmm.
he had previously requested the medication and had the medication, and then transferred to another hospice. So part of the criteria is the person has to be of sound mind, they have to have capacity, and they have to be able to administer on their own. Well, this person's wife was not okay with that, her own, you
Hmm.
know, moral compass, she wasn't didn't really agree with it. But she respected the husband's desire to do that, to have that control over his life. But the thing that happened was the medication expired. And
Hmm.
in the time that it expired, this person lost the ability to self administer. And then it was a very, very difficult situation. Because remember, when people have ALS, their mind is there, even though their body
Right.
just
Hmm.
basically stops moving, they can still
Mm-hmm.
communicate by text and things of that nature. And this person was very angry, very upset because the wife, didn't want to participate. He no longer met the criteria that, the California Department of Public Health has in place. And he didn't want to be around anymore. And so I say that just to say that, make sure you do your research for,
Mm-hmm.
all the
Definitely.
things that you're wanting to participate in. I do have a video where I interviewed a San Diego doctor about medical aid in dying and just put the facts out there for you. Because my goal here is to educate and empower so that everyone can make the best decisions for themselves. But that's something that was kind of tough to endure as a team because, you know, it was tough.
Yeah. Yeah, I imagine so.
Yeah.
Having the medication expire.
Yeah.
Yeah, knowing that that was his wish.
Yeah.
Mm-hmm.
Wow. So, ALS Awareness Month. I remember years ago people did the ice bucket challenge. I know my kids did. Do you remember when that happened?
I remember. Did you participate in the ice
You
bucket
know I didn't
challenge?
have no
Yeah.
you know I I didn't pour no cold ice on
And
myself.
I'm asking because I know you did not.
We can't get our hair wet. No, just
Exactly.
kidding. No, my kids did it, so that should count for me.
Yeah, yes, yes. That was
All
your part.
right. All
Yeah.
right. Well, you have anything you want to say to wrap this up before we send our listeners home?
Buy the book. It gives you good personal insight about hospice care with the personal touch.
Amen. All right.
Yes.
This is the book, The Real Deal About Hospice Short Stories, highlighting the advantages of hospice care for patients and families. So we thank you for being here. Happy Memorial Day
Yes. Happy
and
Memorial Day.
and happy ALS Awareness Month. Peace.
Yes. Peace, people. We'll see ya.